Hello, good afternoon. I think it's fine afternoon. This quite sunny, bright day. A day to just look at a small component of our health, reproductive medicine or health generally. And this is fibroids in relation to pregnancy. And then we'll also touch just a bit on can cysts in the ovary be treated using the new technology, high intensity focused ultrasound. That's HIFU. So to start us off, I know that we have quite a lot of discussion around what fibroids are, the fact that they are growths that originate from the muscle cell of the uterus, and that they can be located at different places, either more inside the uterine cavity or within the wall of the uterus or outside the uterus, or sometimes even on the supporting structures of the uterus. And that these growths that you're referring to as fibroids can cause symptoms. These symptoms are very varied, and the symptoms depend largely on the location of the fibroid, the size of the fibroid, among other things, and of course the number. And the big question that probably pops up into people's minds, especially for women who are in the reproductive phase, is one, how does fibroid affect pregnancy? And I'm here to shed some light. And one is that, of course, pregnancy begins from conception and ends with the delivery. However, the changes of pregnancy may still persist after delivery during the first 6 weeks or so. So the question is, can fibroid affect one's capacity or ability to conceive? And to a large extent, the answer is no. Fibroid does not affect someone's ability to conceive unless it is either blocking the tubes on both sides, or it is so close to the inner side of the uterus, and on condition that probably a pregnancy attaches just on the surface or on top of the fibroid, but that doesn't really affect the conception, but rather increases the chances of what we call miscarriage. Now, if a pregnancy happens and the attachment happens, then what are the risks that are there with this pregnancy in the presence of the uterine fibroid? And again, it is clear to say that this largely depends on the size, the number, and the location of the fibroids. For starters, fibroids may increase the risk of miscarriages happening, as I just explained before. Two is the fibroids tend to grow in size during pregnancy. In a few cases, the fibroid remain the same, and occasionally you might find the fibroid actually may even shrink during pregnancy. This is very unpredictable and is individual based. When the fibroids continue to grow during pregnancy, of course, they make the doctor's assessment of the growth of the pregnancy a bit difficult, because then you have the size of the uterus becomes much bigger than the actual age of the pregnancy. It may make it difficult for the doctor probably to get to hear the baby's heartbeat. It may make the examination, when the doctor is doing examination during antenatal clinic, to be a bit more uncomfortable, a bit painful. And yes, of course, the fibroids might also undergo changes within them, especially when they are bigger. And these changes might contribute to pains during pregnancy. The weight of the uterus together with the baby and the uterine content, basically, that is the amniotic fluid, the placenta, the growing baby, the mass of the uterine muscles and other tissues. That weight already is quite some burden on the pelvis. But then now on top of that, if there are presence of the fibroids, then a patient might actually also present with significant or severe pelvic pressure pain. Further, to a small degree, there could be a risk of the waters of the baby breaking later. And of course, there's a risk of preterm labor and preterm delivery with premature baby being born, or what we call born too soon babies. During delivery, the labor that happens to help expel the baby vaginally depends on the smoothness and continuity of the muscles of the uterus. Now, the fibroids does interfere with the orientation and the alignment of these muscle fibers. And so presence of fibroid might cause ineffective contraction of the uterus during labor process. And that might result into prolonged labor that may result or necessitate a need for cesarean delivery. I'm not saying that fibroids equals cesarean delivery. That is not the position. I'm saying that presence of multiple fibroids disrupts the alignment or the continuity or the arrangement of the muscle fibers of the uterus, and that might affect the effectiveness by which the uterus is contracting during delivery, causing delay or prolonged labor, as we said. Further, if the fibroid, large enough, is lying on the lower aspect of the uterus and causing blockage of the pathway of the baby, that would or may affect or stop progression of labor and results into cesarean delivery. Okay? Now, where there is no low-lying fibroid, the contractions are adequate, the progress of labor is good, and is possible to achieve vaginal birth, we recommend vaginal birth when in the presence of uterine fibroids. Now, following delivery of a baby, whether it is during by vaginal birth or vaginal route or by cesarean delivery, it is important and put in mind that uterine fibroids may increase the risk of excessive bleeding after giving birth, what we are calling postpartum hemorrhage. And that the healthcare worker has to be alert to that possibility and take measures that will be able to minimize that risk. Even during cesarean delivery, the presence of the uterine fibroids make the surgery a little bit more difficult or complicated. And the doctor has to navigate, if possible, to avoid making an incision or a cut on the uterus where the fibroid exists. And in the event there's a fibroid blocking the way through which we are supposed to remove the baby, then we are forced to remove that fibroid during the surgery, so that we can remove the baby safely and then be able to repair. It is critical that if we successfully manage to go through labor and give birth, whichever means, and the baby survives okay, the mother is fine, it is important that later on, really after the period of the phase post-delivery, what we call postpartum period, it is important that the patient is again evaluated or assessed to know what is the size of the fibroids. And again, are they still causing concerns? And whether we can be able to consider management or treating them before the next pregnancy happens. But what happens following delivery? Oftentimes, the fibroids tend to shrink after birth process has happened, and within the next period of 6 to 12 weeks, the fibroid significantly shrinks in size. Sometimes, depending on the nature of those fibroids, they may remain the same. So we therefore have a role as a healthcare worker to discuss with the patient of today's concerns and what their follow-up plan would be. My name, Dr. James Amenge, would be glad to share more insights as the need arises. Thank you.